The Ministry of Health and Wellness is working on an assessment of the health services and infrastructure in St. Thomas. Portfolio Minister Dr. Christopher Tufton says the planned development of the parish will see the population rise, thereby increasing the demand for health services. He discussed the plans at the Yallas Health Centre recently. Gabriel Thompson has more in this report.
A new town centre, a new police station, a new fire station, highways and housing developments, those are just some of the government's plans for St. Thomas in the near future. The parish is a stone's throw away from the nation's capital, Kingston, so its development is expected to drive migration. Hence, the health minister's plans to renew the parish's health system.
And that review is going to look at where the population centres are, look at what the requirements are for health centres like Yallas, the hospital, which by the way has benefited from a substantial overhaul. Started before my time, we finished it. If you go to the hospital now, you will see that it's a much nicer facility than it was, let's say, 5 years ago.
He says as it stands, the hospital has the capacity to serve an increase in patients, but that could change. Dr. Tufton says the Yallas Health Centre is not equipped to handle an increase in population.
Right now you have about 25,000 cases, I'm told, that you handle here, visits per year. But the population centre is expanding and access is improving. And so we're going to have to take a very keen look to see what can be done. And I think Yallas will benefit over the next few years.
Fortunately, the health centre will not have to wait for aid in development, as it has become the latest facility to benefit from the ministry's Adopt a Clinic initiative.
It is more than a recognition of a need, as important as that criteria is, that characteristic, that feature is. The adoptions tend to be almost a sentimental attachment to a community. It's a recognition of the value of that community to the adopter's upbringing. Because even though the rules don't say you have to come from the place to adopt, of the 35 or 36 adoptions we have, I'm prepared to tell you, it's either by institutions that are located in the area or by people who were born and grew up in the area, left, and want to contribute to the development of the area.
The sponsors of this adopted health facility are Mr. and Mrs. Foster of the D. Terence Foster Foundation.
When I look around and I see the clinic, I could see that our clinic, even though we've had some addition, the population has grown so much more than it used to be. The needs of the clinic is still extremely significant. And you know, what we're doing is, although it is a significant part, it doesn't meet the needs of the clinic. So this clinic needs a lot more. You can look at the staff, of course, has grown much more than when I used to be here. The patient load is growing much more. And things have gone so much more difficult compared to 40 years ago or more. So the need is there.